I'm Kara Gavin from the IHPI Communications team, and thank you so much for joining us. This is a great special event about communications, and something that IHPI and Dr. Anian care about very much is making sure that medical research and healthcare get covered fully and accurately in the media, and that institutions are doing a good job of promoting the work of our faculty and their research. So that's why we've invited Gary Schwitzer here from healthnewsreview.org. And he is someone who I met actually a year ago at a conference for healthcare journalists, and saw him give a talk to journalists on helping them cover health news responsibly and accurately and get the statistics right. And it occurred to me that it would be great to have him come to Michigan. And as it happens, just about a year ago, his website started reviewing news releases from institutions like Michigan. They had been already for 9 years reviewing news stories from healthcare journalists around the country and giving them 1 through 5 stars for accuracy, and he'll describe that in his talk. But the idea of applying that same methodology to the product of institutional PR, I think is really important as we get into this new age of direct-to-consumer news delivery by institutions, and all of us who either create and disseminate news or faculty whose work is being presented in that way, I think can take a tip from what Gary and his team do. So his team at Health News Review is about 50 strong, 3 full-time and others who are part-time reviewing news articles and news releases on a daily basis, and I really encourage you to check that out. Gary's been running that site now for 10 years. It has foundation funding, and it basically builds on his experience as both a television journalist, former head of CNN's medical unit, as well as a former journalism professor at University of Minnesota, the other U of M. And he is currently an adjunct professor in the School of Public Health at Minnesota, as well as running the site. An award winner in many regards, a former director of the Association for Healthcare Journalists, and I think just someone who has surveyed the landscape of health news and how the media cover medicine, and has a lot to offer, from stepping back and looking at accuracy and also how can we improve things because of its impact on the public's health. So without any further ado, Gary Schwitzer.
Thanks, Kara. Well, thank you for having me. We appreciate the chance to share our work with audiences, especially an audience for which it's so appropriate as it is for this group. And you might think that based on the name of our project that it is primarily a journalism project, but it's not. And the title of the talk should suggest where my heart really is with this 10 years of work, that this is very much a public-targeted, patient-centered effort. I've told several people already today, I view this, I don't think this is being grandiose, as really a rubber meets the road healthcare reform, health policy initiative, that if we don't improve the public dialogue, it seems to me we don't stand much chance of affecting truly meaningful healthcare reform. So I'd like each of you, I'm guessing that we have many different roles here. Some clinicians, some primarily researchers, some MDs, PhDs, MPHs, grad students, I'm told, and others. But I'd like each of you to think about, as you, especially with the first example I'm going to lead with, the responsibilities that we all have at different levels of the food chain of the dissemination of especially research information to the general public. And with this first case, if you're not very close to these issues, I think it will open your eyes a bit about how the sausage is made, and as with making sausage, it's often not a very pretty picture. The difference here is sausage can be a good end product, and I don't think we often do end up with a good end product with the dissemination of research information to the public. So what you're looking at here is a news release from, and I know this is small for some of you, but it's from a translational research outfit based at the University of Maryland. And this was a news release that was published both in print and this online in December of 2015. And so it's a collaboration between university researchers and a company producing this specialized chocolate milk. And you can see the claim on the big graphic, concussion-related measures improved in high school football players who drank this milk. It's a very slick news release. It went to some depth. Here's a quote from the principal investigator. Athletes who drank the stuff compared to those who didn't scored higher after the season than before it started, specifically in the areas of verbal and visual memory. Well, this is where we came in. So with news stories for 10 years, 2,200 of them so far, and now in the past year with healthcare-related news releases that include a claim of efficacy about an intervention. That's what we really look for. That's our sole inclusion criteria by media organizations and news release disseminating organizations that we look at regularly. If it includes a claim, it's fair game for us to review. And there were our antennae, our fireworks were going off throughout our initial read of this Maryland review. This is what we published January 5th of this year. This was just our headline. And as Kara suggested, we apply 10 criteria to the review of stories and news releases, and how you do on those 10 criteria is converted into a star score of 0 to 5 stars, like a movie review. So you see already this one didn't do very well. And here's why. This is some of what our reviewers wrote, playing off the got milk line, got facts. There weren't very many in this news release. Perhaps the most worrisome aspect, you can see here we already had questions putting study in quotes about, well, what do we know about this study? And in fact, we had some doubt about whether there really was a study based on how little was provided in this news release. We wrote that the release paints a picture of benefits going far beyond any results, any data that are provided. There weren't any data. Most troubling comment comes from a school official who seemed prepared to buy this product lock, stock, and barrel because, after all, there's nothing more important than protecting our student athletes. Well, we didn't stop there. One of our reviewers pushed even further, which we don't often do. So writing to the university and saying, this was in the data freeze spin zone, where's the data? And immediately we were being stonewalled. And it's clear now, in retrospect, I think the university knew its knees were mired in mud and they needed to get their act together. And then nationwide news coverage picked up our little lead and ran with it in a way that major news media have not picked up on anything we had done in the prior 10 years. So I'm just going to spin through some of the headlines. These are not the kind of headlines that any institution would like to see about their own work. And these were all from leading sources around the country following our lead. So clearly, the university knew it couldn't run from this, even after what we initiated, much less after the news coverage that followed. And 8 days after our initial news release review was published, they announced an internal investigation at Maryland. The VP of Research said, my reaction was, this just doesn't seem right. I'm not sure what's going on, but it just doesn't seem right. Well, 3 months later, and after we had published 9 articles in all about this public relations fiasco, the university released the results of its internal review, and it's clear that it was far more than a public relations fiasco, that in their own review, they pointed to a concerning lack of understanding of the basic principles of conflict of interest at all levels of the process. The principal investigator expressed less concern for and was less attentive to the potential for research conflict of interest, in part because they felt this translational research project was in support of small business, which after all is highly encouraged by the state and heavily promoted by the university. When he was asked to explain why he hadn't declared a conflict regarding $200,000 in funding from a milk foundation, he said that since the money had not gone directly to him, he didn't think that it was a conflict of interest. These are earth-shaking discoveries, I think, for the university, and I think should be for anyone who looks at this. But hold on, there's more from this internal report. The investigators wrote, "There are simply too many uncontrolled variables to produce meaningful results. We found this particularly troubling since students were used as subjects, and they found there were no institutional protocol for approval of news releases, and lines of authority were poorly defined. The report found that the principal investigator was given the default authority over the news release about his own work, and that he disregarded generally accepted standards, so they recommended that in the future, news releases should never include study data or conclusions, even preliminary, until they've been subject to peer review." That's a standard that I can tell you is not met by most universities in this country, and under most circumstances accepted for publication in an appropriate peer-reviewed journal or book. The strictest standards for peer review should be applied to research results based on human subjects or animals. In all, the internal review made 15 recommendations to bring the university in line with accepted norms, and it is a safe bet that none of this would have come to light had it not been for this little not-for-profit university-based effort of ours and the news coverage that we spawned. And now I can't help but think how we're almost obliged to look more closely and further how many other examples, even in or especially in the field of translational research, are we likely to find now that we're looking. So while this was definitely an awful period for the University of Maryland, I just ask you to think, what if that logo someday would change, and I wouldn't wish that on you in 100 years. So a little bit about how we operate. So as I said, 10 years of news story reviews. The inclusion criteria, as I said, is really quite simple. Make a claim. There are always 3 reviewers per story, and it's almost always a journalist, an MD or PhD, or somebody who is especially trained in the evaluation of evidence, although our journalists are as well. And then a journalist is always the 3rd reviewer, drawing from a team of 50 part-timers. If your work is reviewed, we email you and send you a link to the review so that you can learn from it. And all of this is posted online with all of our commentary about why we found something satisfactory or unsatisfactory. Because I think there are thousands of lessons embedded in these thousands of articles that we've reviewed. So this is going to be a very busy report card screen, but I'm going to leave it up here for a while. And so let me go down the left-hand column to begin with, because these are our 10 criteria to begin with, the criteria we apply to news stories. So remember, inclusion criteria is it made a claim. Well, in making a claim, did it discuss costs? Beyond just discussing potential benefits and harms, did it quantify benefits and harms? And we hold the bar fairly high and make no apologies for that, that if a story or an article uses relative risk reduction figures, for example, we don't find that satisfactory. It must at least include, in addition, absolute risk reduction or solely the absolute risk reduction. Did the story evaluate the quality of the evidence, or did it treat a 12-mouse study as if it were a 3-year, 3,000-person randomized clinical trial in humans? Did it commit disease mongering? So did it exaggerate the prevalence or seriousness of a condition? Did it treat risk factors as if they were diseases unto themselves? This is probably the most wide-ranging and possibly the one that introduces subjectivity more often into our reviews, but I think it's a good criterion. Did the story include independent sources, and did it look for conflicts of interest in the source? In discussing the new, did it put the new into the context of existing alternatives, which by definition have a longer track record, so we shouldn't ignore that in just talking about the new? Did we explain the availability, or did we make a phase 1 drug trial sound as if it were available now at the corner drugstore? Did we explain the true novelty, or was this a story about the 7th erectile dysfunction drug that we're going to see advertised during the Super Bowl? And did the story seem to rely solely or largely on a news release? And here's that report card then. So what you're looking at is the percent of satisfactory scores for almost 2,200 news stories. So only 31% by our independent reviewers were judged satisfactory on the cost criterion. And I don't think that these 10 criteria are equally weighted, equally important. But it's interesting that if I were to draw the line on what I think are the most important, it's the 5 worst performers, the top 4 and then alternative options. So we're in the 60 to 70% framework, 2,200 stories in the eyes of independent reviewers that on most days make interventions look terrific, risk-free, and without a price tag. So I always think about, what does this do to the individual decision-making? What does this do to the shared decision-making encounter when the patient comes in waving articles to their doc? What does it do to the voter going into the voting booth next to me who is going to oppose any candidate who ever says anything like comparative effectiveness research? Because this kind of a news pattern, I think, trains the audience, because of the way things are framed, to expect that comparative effectiveness research is rationing, not rational. We're just ships passing in the night on many of these issues about the benefits and harms and other issues involving public communication of new interventions. So here's our smaller sample, since we just started a year ago reviewing news releases from all kinds of sources, and only 150 of those so far, but this is building by the day. And you can see in almost all categories the grades are worse for news releases from these leading sources. And for this criterion and this criterion, we didn't think that the news story criteria language worked, so we have different things that we're looking for on those criteria. But still, you can see cost is just, I mean, we're just not ever talking about that in healthcare-related news releases. Awful batting average on benefits, harms, evidence. And this last one, we give examples of what we consider sensational and over-the-top language, including things like, I wish we could ban the term game changer. Obviously, when I was editor of the MayoClinic.com site, I wrote an article about the 7 words you shouldn't use in medical news. Let's see if I can remember, but it was miracle, cure, breakthrough, promising, victim, hope, dramatic. That's 7. I didn't dream up, those were not my words. Each of them were put in my head by patients that I had interviewed through the years. Some of them in a very compelling way and in a manner stronger than I might have as a journalist. So this is a really bad report card, in my view, across the board. And it's, if I could draw a picture, it would be a huge tsunami washing over the American public every day. A tsunami of crap, often, frankly. And we're not giving these people the tools to evaluate. And I use a lot of water analogies. So we're drowning them with this tsunami, and they only want a little sip of clear, accurate, balanced, unbiased, meaningful information to help them navigate this terribly confusing healthcare system and panoply of choices that they face in their own lives. And we're not helping them, and we could. That's the thing. The answers are within reach. So if this were a one-slide talk, and I'm sorry for you that it isn't, this would be it, because this captures it. And so it's not an off-the-cuff subjective observation. This is a data-driven mirror that we hold up to editorial decision makers. that we clearly, and it's interesting, when I talk with a lot of open-minded physicians, they'll say, this is what we often do in the clinical setting as well. So if you think about Joe and Mary Blow reading their morning paper, get this exaggeration and this minimization. Then they come in and see their doc and they get the same thing. Well, maybe there's a reason why we spend a greater percentage of the GDP on healthcare than any other country on the face of the earth without the outcomes to show for it. So the scales of justice graphic, I think, is appropriate because this is an injustice to news consumers. So the most common flaws, again, I could stop right here. It's conveying a certainty that simply doesn't exist. How do we do that? We exaggerate effect size, like absolute versus relative risk. We frame things in the most positive light. We use causal language to describe observational studies. And this creates like an editorial tennis match for the audience that coffee cures you for one thing one day and kills you for another the next. And coffee is the poster child for miscommunicated observational studies, I swear. Failure to explain the limitations of surrogate markers and endpoints, which leads to this trend. We have a TV station in the Twin Cities that has a constant know your numbers campaign. And so we're just getting people to be fixated on numbers and surrogates, and we don't train them on what are the outcomes they should really care about, like did anybody live longer or better? Common flaws of single source stories with no independent perspective and failing to independently analyze the quality of the evidence. This is clearly something we're in the academic setting, and you're probably already doing a good job of this, but to make your people available to journalists all the time to help them evaluate the quality of the evidence. And I hope you'd back me up on this. I always tell journalism crowds that they ought to have a biostatistician on call at all times, and that I bet if you made the pitch to them, they would do their work pro bono because they too are driven up the wall by how they see research results miscommunicated. Are you biostatisticians? Okay. You get the line though. So there is a growing literature on some of these practices. So here's Woloshin and Schwartz, whose work I admire deeply, from Dartmouth on translating research into news. They reviewed releases from 9 major journals. Only 29 of 127 that were included, of 127 included any study limitations. Only 5 of 23 that were on studies receiving industry funding disclosed that fact. You're starting to see a pattern here? And they wrote, press releases do not routinely highlight study limitations or the role of industry funding. Data often presented using formats that exaggerate the perceived importance of findings. And that's what we've seen in 10 years of work. This PLOS Medicine article was interesting in that it sort of tracked the food chain that I was talking about, that positive spin in news stories could be reverse engineered back through spin in the news release, back to spin in the abstract or in the published study. This is what I'm talking about, that all of us in this room arguably have a role in turning this picture around, and we lose sight of the people we're here to serve at the end of the food chain, the reader, the consumer, the news consumer, the patient. Does anybody follow Richard Lehman's work? Oh my gosh, if I came back in a year, I'd like to see every hand up. So he's I believe he's now retired or semi-retired in the UK, a GP, and he publishes this terrific weekly journal review blog on a BMJ website. And it's that dry but incisive British wit and clever, and I just love it, and it's a must-read for me. He once wrote, and I too was once a conclusion of the abstract kind of guy, smug that I even got that far. It took me years to become aware of the most important principle of critical reading. Never believe the stated bottom line without confirming it from the data, and beware of the limitations of the data. He also reminds us that 350 years ago, the Royal Society of London for Improving Natural Knowledge used as its motto the Latin nullius in verba, the rough translation, don't take anybody's word for it. And this is not a cynical perspective in my view. This is a healthy skeptical perception or perspective. Here was an article in the BMJ, the association between exaggeration in health-related science news and academic press releases. So 40% of the releases contained exaggerated advice, 33% exaggerated causal claims, 36% exaggerated inference to humans from animal research. And when the news releases had that kind of exaggeration, look at the rates of how that showed up in the news stories. Again, a clear documentation of the food chain, of the contamination of information before it reaches the public. The reporting of the limitations of observational studies I've already hit on, but here was a paper in JAMA Internal Medicine. The fundamental limitation was rarely mentioned in journal documents or news stories and was often accompanied by a disclaimer. Possible consequence is that readers consider the reported associations to be causal, promoting practices based on evidence of modest quality. That's why this matters. That's why this isn't just an academic concern. And there are easy ways to explain this to the public, that just because the rooster crows every morning as the sun comes up does not mean that the rooster is making the sun come up. And if we look around, there are people, Woloshin and Schwitzer are two of the leaders, who have found very effective ways to introduce these themes to an elementary school audience. So another example here. How did this basic science paper in a journal that I'm sure all journalists read every week become this? See hydrogen sulfide in the title up there. But beyond this, hundreds of thousands of more examples. All because we could say fart in a headline. We had another example recently. It is the umpteenth iteration of the breast cancer detecting bra. And because, like little boys in 7th grade in the locker room, we could say bra, there were hundreds of thousands of stories about this completely non-evidence-based approach to breast cancer detection. We must do a better job. And how did this all begin? With an institutional news release that didn't have to, but chose to say flatulence in its 4th word. And boom, we're off and running. And the stench spread. Too often, we're treating journal articles as if it is Moses bringing the stone tablets down from the mountaintop. Mayo's Dr. Victor Montori wrote to a journal club, beware spin, composite endpoints, surrogate markers, subgroup analyses, inadequate comparators. Above all, avoid the intro and discussion sections, which is where most of the interpretational spin is introduced. But Victor, and I know he knows this as well as I do, many journalists who feed off a steady daily diet of journal articles don't know what any of those things mean and are lucky to even get to the intro or discussion section of the paper because they probably are feeding just off a news release. And that is a sick environment that we have to correct. So why does any of this matter? Because we are often mired in an ugly, uninformed public dialogue about healthcare. We spend a greater percentage of the GDP, I made that point already. We whip the worried well into a frenzy, raising unrealistic expectations of what the healthcare system can deliver. And we raise undue demand for unproven interventions that once we have the evidence, we may find cause more harm than good. We probably do more screening tests outside the boundaries of evidence than any people on the face of the earth. And so when we do, we clearly overdiagnose and overtreat more pseudo-disease that would not have caused harm in many people's lifetimes. Journalists, and we all could, help the public better understand that in healthcare, newer isn't always better, more isn't always better, less can be more, that bad things happen when we redefine normal states of health as if they are ill health that must be treated, that there are trade-offs. This goes to the heart of our criteria on benefits and harms involved in any healthcare decision. There's something you stand to gain, yes, but there's something you stand to lose, and you better understand that up front. We can find easy ways to educate. So I always tell people, if you ever hear anyone make a claim about a simple blood test, run for the hills, because there ain't no such thing. If you ever hear anyone say that a drug may be a game changer, could be a new standard of care, go ahead and feel free to substitute may not or might not, because you'd be on equally safe or shaky ground. And whenever you hear about a first-of-its-kind procedure, ask about the learning curve, if it truly is a hands-on procedure. Because if a doc needs 700 procedures to become proficient, do you really want to be number 1 through 699? And this may have changed through the years, but that was at one point a published learning curve on robotic prostatectomy. We can help the public not run from uncertainty and don't promote certainty where it doesn't exist, but to grasp uncertainty, that this is what science is all about. Grasp it, address it, attack it. That's how we all get smarter. So it was somebody in Europe who coined this phrase, infoxication. It doesn't necessarily have anything to do with Fox News, but it's a short for information intoxication. And it's, again, almost one of my water analogies and the food chain here. And we lose sight of these consumers at the lowest rung of this ladder. Those of you who are clinicians know about this really interesting movement towards slow medicine. In parallel with that, I'd say we need to practice more slow journalism. Clearly, it's better to be second and correct and helpful rather than first and wrong and harmful. It's interesting. I found myself glued to this. I don't know why. I watched the entire thing. I remember when it was promoted, I said I'm not going to do it, but I did. But I remember how I told somebody earlier today I was sucked in watching the White Bronco on the TV in 1994. But it's interesting that millions watched this now 20-year-old story about how a defense team won in part by playing to emotion and by getting people to ignore mountains of evidence. But in healthcare, this happens every day, and we don't call it a crime, and nobody puts it on TV as a crime story. And I don't think that's a leap. I said before, it's an injustice the way we deliver a lot of healthcare news and information to the public. And it bugs me, but we will stay at our typewriters and keep the watchdog at work. And I think we have a lot of time for your comments and questions and suggestions and pushback or whatever you have. But thank you for your attention. And do you want people to come to the mic for questions or no? I can hear you, so.
Yes.
So I'm not trying to pass any blame, but what part of this do you think comes from journal editors? Like, I know a lot of scientists would like to present more limitations and not exaggerate it, but it's not going to get published in a high impact journal maybe unless you have a cleaner story without all the limitations and without.
The question in short was how much of this responsibility lies with journal editors. And there's an old friend of mine, a crusty senior colleague in the School of Public Health at the University of Minnesota, who after a similar talk like this said, Gary, I respect your work, but this is just not a good use of your time. You should be applying all your efforts to reviewing things further upstream with journal practices. Well, that's not who I am, and that's not the world that I run in. I am just an old journalist, and I choose to come at it this way, but I view this as some of the low-hanging fruit. Lord knows, though, there is enough to go around, as your question implies. And I do think that journal policies in what gets published within the pages of the journal is a huge issue. And I certainly know that journal policies with what they let get published in their news releases is an issue. I had a long-standing back and forth with the BMJ, which I often respect, usually do respect, but in their news releases about observational research consistently used causal language. And I think we've overcome that now, and they actually have started to put in boilerplate language saying that there are limitations and didn't necessarily show cause and effect. But there are a lot worse instances than that in what we see in journals. I've seen journal articles, some of you probably have as well, where on the absolute and relative data question, for example, within one paper, relative risk figures were used to describe a benefit, and absolute data were used to describe harms. And why would that be? Because it's exaggerating, emphasizing benefits and minimizing harms. Again, it's the third time I've mentioned them in this talk, but Woloshin and Schwartz have had some outstanding examples of that I know they've shared with journalists. So there are others. My friend Ivan Oransky co-publishes along with Adam Marcus the Retraction Watch blog, which I remember when he launched it, I said, nice idea, but whoa, how often are you going to be able to publish anything? That's such a niche topic. And his publication rate and audience is just off the charts. So I think this is one of the good news stories, is that there are a number of different people cutting off different slices of this pie and coming at it from different ways. And for the rest of my days, I'm probably going to continue to live in this sphere, although I think you're right on the money with your question about journals' responsibility as well. Yes?
At what point in your process do you let people know that you're reviewing their work, and what kind of feedback have you gotten?
When in the process do we let people know about that they're being reviewed, and what kind of feedback have we received? So they don't find out until after it's been published. And I've tried to impress on my team that you do things in this order. You hit the publish button and then you immediately email the person, because I don't want anyone coming from running down the hall saying, Sally, did you see how you just got slammed on Health News Review? That's not the way I want people to hear things. And we really do want to open minds, and we view our effort as constructive criticism, not media bashing. You never know whether you're dealing with the silent majority when you hear from a vocal minority, or whether they represent the silent majority, rather. But I can tell you, easily on the fingers of both hands, maybe on the fingers of one, are the really strong vocal opponents, people who say, don't even bother to email me anymore. I don't accept, you have no right to judge our work. And those people, they've got a problem. Because any of you has a right to question their work. You are the end users. And those of you who are clinicians, your patients are the end users. And anyone following our 10 criteria, I actually think, with very little training, is equipped to learn how to become a smart analyst of claims about interventions. So that's actually been very gratifying, that I truly do believe that the majority of journalists are open-minded. They know what they don't know. They know what they're not getting in their own newsroom in an era when staffs have been cut back. I just read another troubling article just the other day. I can't even think where it was based, but copy editors now being slashed. So fewer eyeballs on each piece before it gets published. These things really matter. And I know that tears at the heart of caring journalists. And so I think the open-minded folks know we're there to help and really do appreciate it because they're not getting it anywhere else. There isn't another effort like this in the US that does this every day. And we've done it every day for 10 years. I went 19 months without any funding. I kept doing it through those 19 months. I never thought it would last this long. I gave up a tenured position in the journalism school at Minnesota to do this because it just seemed like what my life's work should be at this point. So I'm very gratified that people have accepted this. And we haven't even talked about the lay public. The outreach there has been very gratifying. The number of people who say that they've learned to scrutinize stories and claims like they've never heard or never knew before. So that feels good. Yes?
How much of a problem are anecdotal leads to news stories?
Well,
What can we do about that?
yeah, believe me, I know that, that narrative, including the anecdotes, sells. So if we have to play that anecdote game, and perhaps we do, I hesitate to suggest this, but then we better in many stories have dueling anecdotes. So I'm sorry, it often is just not very helpful to have stories about the person who says that their life was saved by screening, which is something that can never be proven. And we don't tell the stories because it involves more shoe leather or phone work, but it is important to find the people who regret not being informed and not asking some of these questions before rolling up their sleeve for that simple PSA blood test, or before putting their breast on the plate in their 40s for a mammogram, because they never knew anything, because no one ever told them about trade-offs, and they never really benefited from a true shared decision-making encounter. I've worked on both sides. When I left CNN in a great deal of dissatisfaction, and I went to work for the Foundation for Informed Medical Decision-Making based at Dartmouth, and I produced decision-making programs throughout the 90s, and it actually felt like I was still in journalism because you were telling stories, you strove for accuracy, balance, completeness, you tried to help people, and so I feel like I've lived with one foot in both of those worlds of journalism and shared decision-making, and news often just doesn't set us up for a shared decision-making encounter. It sets us up for a conflicted, single source, inaccurate, imbalanced, incomplete, skewed presentation. And I feel for primary care docs who have to face that every day. How many of you are primary care physicians? Okay. Only 2 of you. And do both of you have patients coming in waiving articles from time to time?
Not waiving articles, but often asking about things they've read in the news.
Yeah. That's almost a universal response that I get. So did that answer your question?
Yeah, thanks.
Of course, another way around that would be, sometimes to report against the status quo or the weight of past information is good journalism. And so to lead a story with the more counterintuitive anecdote can be compelling. If you got to have controversy in your story, Lord knows it would be controversial, and it'd probably be helpful for public understanding. I wish we didn't have to play the anecdote game at all and that we could focus more on data and evidence, but I know the reality, so I hope that helped. Someone else? Yes?
to review, do you focus on research that has gotten the most media attention, or just because of the sheer volume of?
Yeah, so remember, we're doing this in real time. So while I'm traveling today already now for hours, people rolled out of bed. One person looked for reviewable new news releases. Somebody else looked for new reviewable news stories, submitted them into our system. We can never review everything that falls into our net. And so we choose based on a couple of different things. So remember, it has to be a story or a news release that includes a claim about an intervention, so treatment, test, product, procedure, dietary approach, behavioral modification. If it's an intervention, the claim is made, it's reviewable. And if it's we only have a set list of major news organizations that we look at every day and a set list of news releases. But to be accurate about this, or to give you the context, so I told you we can't review everything. I'll bet that on any given day, the rate of submissions to reviewed for news stories is something on the order of 7 to 1. And for news releases, it's often 10 or 12 to 1. And so then we decide, if you have competing things, you can't do them all. Well, which topic applies to a broader segment of the audience? That's number one. You still might have competing sub-choices. Then, well, which was done by a source that we've never reviewed or we haven't reviewed recently, and that comes into play. And then sometimes, although not often, it's which of our far-flung team of part-time reviewers are available on any given day and who would really be good on any given topic, things like that. Yes?
So with the chocolate milk story, did you go back to look at a wider sample of University of Maryland press releases, and was that one atypical or representative?
That's a really good question. Did we go back after the Maryland chocolate milk concussions news release to see what their earlier body of work had been? And I think we need to sign you up for our team, because no, we had not done that. But as I've already just said, and you can appreciate, I'm sure, on any given day, 10 to 12 to 1 submission to reviewed. There are many things that we'd like to do. And then you're tempted to just refocus and hone in on certain things, but then you're going to lose so much else that is in that net. But that's a great idea. And maybe moving forward, we'll do that with other examples. I really do fear that that's just the tip of the iceberg, that either we haven't been looking or we missed it, but I predict we'll find a lot more, especially in that world of translational research, where so many of the incentives might be in the wrong direction, as was stated by their own internal review team. Criticisms are welcome, pushback, or ideas for the future. If not now, my email is real simple. It's gary@healthnewsreview.org. And you're a smart crowd, so I would be foolish not to listen to your comments and advice. But, oh, we're not done yet. Good. Good.
So, I'm sitting here thinking about the sort of tension between a news story or a press release as telling a narrative about the study and the findings and why we should care about it, and its role as a reference document to provide the full context and details. And those two purposes are to some degree in conflict with each other, because the volume that you would want for reference is not necessarily conducive to telling the story in the cleanest way. And I guess I'm just sort of asking, is part of the problem here, and I say we, speaking as an investigator, but it obviously goes up and down the food chain, are bad at really knowing how to recognize what the true story of a particular scientific finding is. And how do we think about using what you're doing to train ourselves, not just to check the checkbox of we threw this in for reference purposes, but to actually train ourselves to tell those stories in a more contextual and nuanced way.
Yeah, and I know that's a pet theme of yours because of the conversation that we had earlier, and that's so very well stated. So we miss the forest for the trees. Yeah, so this isn't exactly what you're asking, but I think there's a context here that we need, a historical context here that is helpful to help us remember. So, you know, I've been doing this for 42 years now in some form of healthcare journalism. And when I started, journalists were not, a few were, and I mean a very few, probably on the fingers of one hand, in this country, living week to week based on what was in journals. Journals were not, some of them might be now, but were not intended to be sources of fodder for the 24-hour news cycle. They're meant to be a forum for conversations among scientists. Here's my work, I've given it my best shot, undergoes peer review, let's put it out there for comment. Now, and I've seen this change in my career, there is this expectation that they are there for media as much as anything else. Now, very quickly, let me insert here. So I'm not being a Luddite. I am a strong believer in a science literate public that has the right to, and indeed the need to, access in an open science forum more and more if they're so inclined, and if, a very important caveat, they are so trained. And it doesn't require a PhD. So they must know the landscape. And so many journalists, as I was, I started off at the NBC TV station in Milwaukee, and one day, and I was the young gopher. My nickname was the Scruffy Kid. Can you see why? And the news director tapped me on the shoulder and said, "All right, kid, you've done a good job, and we figure you want to be on the air because everybody wants to be on the air. And here's your chance, because nobody else wants it. We're starting a medical news beat, and nobody else wants to deal with doctors full time." So the gun was to my head, take it or leave it. And I wanted to do sports. But I had a former All-Pro Green Bay Packer, a still current Milwaukee Brewer, the dean of Wisconsin sportscasters, and the play-by-play guy for the Packers ahead of me. So fifth string was not exactly a good future for me, so I took it. But that's the way it still happens with a lot of people today. Here, kid, we got nobody else. We've cut a lot of our staff, and consultants tell us that the public wants more health and medical news, so take it and run with it. Good luck. And don't ask to be sent off for training or to go to conferences. You're going to have to do it all from your desk. And by the way, you've got a quota of 5 stories a day. And you know that is why you get what you get. I'm not going to name names, but from some leading news organizations in this country. And so they are not equipped to read journal articles to deliver what's the real story here. And so they fall prey to whatever's in the abstract. Remember Richard Lehman's warning about being a conclusion of the abstract kind of guy. Remember Victor Montori's warning about reading the conclusions or the discussion section or the intro section. They don't have any framework to do that, and so they pass along messages which really encourage more scientific illiteracy on the part of the people they're supposed to be serving. So if you don't know about Brian's work, he just told me a little bit about it before we came down here. It sounds really fascinating in having MPH students. Do you want to talk about it a little bit? You summarize it very briefly, Brian, because if people don't know your work.
I teach a course mostly for master's students in the School of Public Health. And I teach a course on risk communication, which is obviously very relevant to this, but I also teach a course on what it takes to make a message memorable and sticky. drawing on principles of concreteness and simplicity and emotion and unexpectedness, etc. And a lot of that is about storytelling. And so we talk about how do you tell the story of a research article. And there's this, we were talking earlier today about the sort of inherent tension between telling a story in a memorable way versus presenting it in a balanced way that will capture the nuance and the context, et cetera. But what has struck me by teaching how to be persuasive is it draws our attention to the ways in which we are unintentionally persuasive. And it's that awareness of, if I do this, then I know I'm going to be persuading you, that then makes us more aware of the ways in which I didn't actually intend to persuade you, so I better not do that.
So I hope I addressed your first comment, Brian. I mean, that's that historical view of how we've come to look on journals, not for what they were intended to be, but for what we wanted to make them into, I think has been, well, as with many things, there are trade-offs. There's been some benefit from it. Yeah. And that leads me into, I've not said this anywhere here, and I do talk squarely out of both sides of my mouth on this issue. We are simultaneously seeing some of the best health medical science journalism that we've ever seen in this country. I often have a slide about mountain peaks of excellence, often deep data-driven special projects, many of them foundation funded, like ProPublica, Kaiser Health News, and others. But the valleys in between these peaks of excellence that I call the daily drumbeat of dreck are becoming wider and deeper, and the harm that is done in that drumbeat of dreck may overcome the good that's done on these peaks of excellence. But it is never right to conclude a talk like this, and I don't have to conclude it yet if you have more questions, without making a nod in the direction of some of the really good work that's being done. And we try to shine a light on that whenever possible. STAT, the new effort that was launched by the Boston Globe but is now a separate entity, if you're not reading that online, is really off to a fantastic start. And I could go on and on and on, but again, I think in terms of numbers and potentially in terms of impact, the poor scores that I've documented for you here may cause more harm than good and overwhelm the good. Let me throw out one thing where you could help me. So we're trying in many different, in as many different ways as we can, to use different media formats to reach the general public and to reach patients and news consumers. So I got a small grant from the National Institute for Healthcare Management Foundation last October to begin experimenting with audio podcasts. And so, you know, I've interviewed some leading researchers who I think are real thought leaders and been very happy with that. I've featured a couple of outstanding healthcare journalists because I want the public to be able to hear from them directly in their own words. But the thing that I feel best about is I now have posted 3 different podcasts telling patients' stories of their experiences being harmed in one way or another by misleading media messages about healthcare. So I featured the sister-in-law of a guy with glioblastoma, and she tells the story of the roller coaster from despair to hope, which she helped feed by telling her sister, his husband, about a promising new treatment that was really overblown, and he broke down in tears. And I get angry every time I think about that story, and that's why I like telling stories like that, because we need to learn from them. I interviewed the director of a rare disease foundation, the Primary Ciliary Dyskinesia Foundation, who was actually upset with a journal for the headline or title of a manuscript which she knew was being reviewed, and she contacted them pre-publication and they wouldn't change. She predicted it would cause confusion in her patient population, and indeed, within hours of publication, it did, which just shows a journal out of touch with the impact that journal articles have these days, that a Facebook page for primary ciliary dyskinesia actually can spread news like wildfire within hours of publication. So that was another topic. And then the third was a 50-year-long migraine patient who is now a patient advocate and educator for migraine, heard about just an egregious television story that was done by a network-owned and operated TV station, and has appeared in other markets then across the country, talking about a new migraine treatment for something that has never been tested in migraines. So it was, and the smoking gun is that the manufacturer was pushing for early news coverage of this. Oh, I didn't tell you, the last chapter on the chocolate milk concussion thing, Candace Choi of the Associated Press reported last week. She got a hold of some documents that show that the company, the chocolate milk company, was racing to get that news release out early, hoping that it would coincide with the release of Will Smith's concussion movie. So that story just keeps growing new legs. But where I was going with that podcast thing was, if any of you, because I only have 2 eyes and ears, so I ask for all of yours, if you know about any examples of people in your family, in your everyday life, on the bus, mass transit, whatever, who talk about being harmed by misleading media messages and might be willing to talk with me. I'm not on a witch hunt here, but I always look at it this way, and I always tell journalists this, that look, I know you don't roll out of bed in the morning, put your pants on and say, how can I go in and screw up today? How can I go in and hurt people? But the harm, unintentional though it may be, is nonetheless very real. And they don't know that. And they don't know that unless we tell them stories of real people who are harmed by inaccurate, imbalanced, incomplete stories. So if you know of anybody, I can leave you out of it, I can leave the institution out of it. I only want to hear the person's story. And that's how I got these 3 on glioblastoma and the rare disease and migraines. And I'm looking for more, because I think there's a power in that, where I can then hold up a mirror. I can already hold up a data-driven mirror and say, this is what you're doing and what you're not doing. Now I can hold up a more qualitative mirror and say, but here's the proof this is where you're hurting people. So Gary at healthnewsreview.org if you have any stories like that come to mind. Kara?
Just for the sake of finishing up, what key things do people in academia need to do to help this get better?
Yeah, so what key things can people in academia do to help make this better? Make yourself, if you're not already, and you may very well be, and from what I've seen, you folks do really good work here, not only in delivery of healthcare, but on the communications front. But you know, Kara, that's not going to change anything in the future if we forego hype at all costs. Again, keeping patient harm in mind. Just be as open and transparent about your communication as possible, including internally. So I feel for the communications folk who are charged with getting the word out, and they may not hear about a study until maybe somebody at the journal communications office contacts them and says, oh, how can we get the word out about your investigator, and the U of M communicator doesn't even know about it. That's a fine line to walk, because no one is well served by self-promoting researchers who go outside the boundaries of what should be promoted But let the communicators deal with that. They'll know what is worthy of writing a news release about or not. I also wish, and Kara and other communicators from across campus heard me say this in a breakfast meeting this morning, and this is not self-serving because I don't stand to gain anything from this. It's a nonprofit effort that's my labor of love. But I wish if communicators who write news releases are on the same page with us about our 10 criteria or even those top 5 that I talked about being important, I wish they'd find a way to, you pick the verb, endorse, embrace, adopt, promote, maybe on the back of the news release or appended to the news release, where you could almost wear a white hat by inviting readers to say, you judge us, how did we do on this news release against these 5 or 10 criteria? What would be served by that? The open communication of, we want to improve the public dialogue. Help us do that. This is how one effort has been doing it. It's been doing it for 10 years. Maybe you'll learn something from that. Maybe then those who accept those news releases would start to include some of those points in their stories where they may not have. I can't tell you, we used to have mouse pads that we give out to people back in the days when people used mice with their computers that had our 10 criteria on them. We'd give them out at journalism conferences. And top journalists from top organizations would come up to me in ensuing years and say, that's still at my work table, and I can't tell you how many times it has helped me to remember to include things that are easy to forget, like costs, alternative options, absolute versus relative risk, things like that. In asking that question, Kara, do you have something in mind?
I think just the idea of, sometimes we push back and say, no, it's one of the most common things at conferences for PR people. How do you say no to a faculty member and say that's not something that's ready for public news yet?
And that's the value of the Maryland episode, is that not everything done by every investigator under your roof, even with a good track record, even with ample funding, is ready for prime time. And Lord knows there are lessons galore from that episode. Well, again, thank you for your attention and your interest, and I hope our paths cross in some way again in the future. It's good to be here in Ann Arbor.